Cellfina, it's new, so maybe you haven't heard of it, but it's exactly what a lot of women have long hoped for.
Absolutely. An FDA-cleared minimally invasive procedure, clinically proven to improve the appearance of cellulite, and only one place can say they're the first in Nebraska to offer it.
That place is skin specialist PC, Dr. Joel Schlessinger, joins us this morning. Good to see you, Doctor.
Hi.
Great to be here.
No, you've been excited to talk about this. She has, and I was telling you this. There's certain areas that can be treated, right? What are they?
There are great areas like the hips and the thighs, and that works great for cellulite. And that's, of course, where the majority of people experience cellulite, the first and probably the worst areas for it.
So who would be the best candidate for this type of treatment?
Somebody who has an indentation that is very obvious on that area, and we can release that indentation. It can be a line, it can be kind of a divot, but it works on it, and it's a really great opportunity for people who have been troubled by cellulite for years to actually have something that works.
What is cellulite? You talk about dimples, you talk about these dents. What is it?
Exactly. So those are some pictures of cellulite there. And cellulite is where the fat has become bound down by fibrous septi. So think of your fat like little mini marshmallows in your body. It's kind of a nice thing.
I do.
Right.
But those mini marshmallows, if they take fibrous bands and they cut into them, they can cause little indentations that are bound down. And we can release those indentations with this procedure. You can see how dramatic it can be in those pictures.
Yeah, and the left is this is the before treatments, and then as you move farther right, it's hard to see the duration between those. But can you break those down in those four pictures? What we're looking at?
Right. So those are results that happen almost immediately. So when we go into the treatment, we take this little device, the Cellfina, and it actually cuts those bands. And when it cuts those bands, it immediately releases the bands, and so the treatment ends up with a result immediately.
So how many treatments would...
One and done.
One and done?
One and
Just
done.
one
So
and done.
that's where I'm actually cleaning off the area, and you can see that that's the little device that numbs up the area, and that's the actual Cellfina device. It suctions into that Cellfina device, and there I am taking the little needle and taking it and releasing that fibrous septi. So you cut the little fibrous band, it pops right up, and the person goes out and about, and they are able to go about their business that day. There's no downtime.
Oh my
Zero.
gosh.
So how does it compare? There are other treatments out there that are a little more invasive. How does this compare, and what is the experience like for a patient?
Well, so far there have been so many treatments, and none of them have actually lived up to the long-term potential. So there have been treatments that have been helping it for maybe a couple of weeks, a couple of months, but this is the longest lasting. 2-year data and still running. They're just about to release 3-year data, which will show that it lasts that long.
And
3
that's what
years.
we're looking at in some of those pictures, though. You were showing 2
Yes.
years out,
Yeah.
and that was
Yes.
the before and after pictures.
So 2 years out is really superb, because most of the people, the problem isn't necessarily getting it to go away, it's getting to stay away.
Right.
Oh my gosh.
Yeah. Let's talk about cost. I know, because there's people out there watching say,
Yeah.
hey, this is fine and dandy and all, but what is something like this going to cost?
You know, it's really not that much when you compare to the other treatments that have been around. The other treatments that have been around have been low cost over a long time
Yeah.
period. So it would be like a couple $100s, but for the entire summer, and then the next summer, and then the next summer. So it's about $3,000 to $5,000 introductory pricing, and after that it'll be about $4,000 to $6,000. So $3,000 to $5,000, and it's a nice treatment because it's a one and done treatment. We can take care of anywhere from 15 to about 30 of these little, I'll call them indentations on the body, and it really does a nice job.
What are your parents? Well, not your parents. Your patients. What are your patients saying, doctor?
Oh, they are loving it. And the nicest thing about it is that the patients are able to do something that is quick and easy, has no downtime, and it lasts.
Yeah. And Dr. Schlessinger, as always, he brings a treat for our Morning Blend viewers. And today, it's a special. It's save $500 when you mention the Morning Blend on this Cellfina treatment. You just got to give them a call, 402-334-7546. Receive $500 off when you mention the Morning Blend, and that's something that Dr. Schlessinger does for our viewers all the time. What else do you have on the horizon, Doctor? What else is coming up?
Well, you know, the Cellfina has been a great addition, and that is along with the Smart Lipo. So the neatest thing is that you can combine the Cellfina with Smart Lipo. So you take care of the sculpt the body, you take the Cellfina, you take care of the little cellulite that might be there, and you're on board for a long time and nice treatment and sculpt your body.
Yeah, fantastic.
Absolutely.
Amazing technology that's coming out of there. Lovelyskin.com/Cellfina is the website that you can go to. Check that out. Skin Specialist PC, that's where Joel Schlessinger, Dr. Joel Schlessinger is. Lovelyskin.com is the website. Again, 334-7546. And on Cellfina, to save $500 when you call and you mention the morning blend. Doctor, good to see you. Have a great weekend. Big plans for the weekend?
Yes, absolutely. Going to enjoy this nice weather, nice weather, and hopefully we'll get some outside time too. Great
That's right.
stuff.
Yeah, I'm going to mow the yard. That's right. Doctor, thanks for coming in this
Thank
morning.
you.
We appreciate it. Guests of the